The objective of this course is to provide pharmacological basis for rational use of drug. By the end of this course, you should know the pharmacological properties of drug acting on autonomic nervous system, some of their therapeutic use and side effects, and have a knowledge of drug site and mechanism of action. Today is the introductory lectures on autonomic nervous system. Before describing the pharmacology of autonomic nervous system, I would like to explain the significance of autonomic pharmacology. First of all, it is an introductory course to the general pharmacology of complex organ system. Secondly, it provides an excellent introduction to mechanism of drug action and the rationale behind the therapeutic use of drugs. A study of pharmacology of autonomic nervous system is rewarding because it is logical. You learn pharmacology in a logical way rather than memorizing everything. Furthermore, many of the drugs described in this section have clinical applications. How a study of the autonomic pharmacology could be logical? If you know mechanism of action of a drug and add this information to the knowledge of neuroanatomy, physiology of autonomic nervous system, and changes it makes to the effector cell activity, then you easily can predict the effect of drug. For example, if you know that atropine is an antagonist that blocks acetylcholine receptors on a smooth muscle, you also are aware that when acetylcholine is released, it will contract bladder smooth muscle. Therefore, you should predict that in presence of atropine, bladder activity is decreased. This effect is in some situation, like treatment of bladder incontinence, might be useful, while in another situation may regard as drug adverse effect. As I mentioned earlier, pharmacology of most drugs described in this section are clinically relevant. For example, I am going to explain pharmacology of some of the drugs which are useful in the treatment of cardiovascular disease such as angina, heart failure, and hypertension. Therefore, autonomic pharmacology is considered an introduction to pharmacology of cardiovascular system. You will become familiar with vital drugs used in the treatment of shock, including anaphylactic shock. Pharmacology of some of the drugs used in the treatment of bronchitis and asthma are described here. Autonomic drugs used in the treatment of benign prostate hypertrophy are covered. Pharmacology of autonomic drugs which lowers intraocular pressure would be also explained. Some of the drugs described in this section have useful clinical usage for CNS central nervous system disorder, including Alzheimer's disease. Another CNS disorder which will be covered is Parkinson's disease. Therefore, understanding pharmacology of autonomic nervous system prepare you for understanding the pharmacology of drug on more complex organ. So, in this chapter, I'm going to familiar you with general principle of drug action. At the end of this section, you should know how do drugs work. In order to understand pharmacology of autonomic nervous system, you should revise neuroanatomy of peripheral nervous system, physiology of somatic and autonomic nervous system, neurotransmission order and function, pre- and post-synaptic events. You should be familiar with these topics from your physiology lectures. Before we can understand how drugs produce their effect in the body, we must have full understanding of the anatomy and physiology of the relevant organ system. You are very well familiar with subdivision of nervous system. We are going to explain pharmacology of drugs mainly acting on the autonomic nervous system. The autonomic nervous system comprises of parasympathetic and sympathetic subdivision. Sympathetic neurons are mainly adrenergic. That means their neurotransmitter are noradrenaline, and the receptor called adrenoceptor. Adrenoceptors are designated as alpha and beta adrenoceptors according to the potency of drug acting on them. You will get familiar with the action of this type of drugs. Acetylcholine is the chemical neurotransmitter in parasympathetic neurons. Therefore, they are called cholinergic neurons, and their receptors are known as cholineceptors. Somatic neurons are also cholinergic and are covered in this section. Cholineceptors are divided into nicotinic and muscarinic receptors according to the potency of their agonist and antagonist. As we proceed, I will explain how it has been done. A drug produces effect by interacting with a biological target. One of these targets are neurotransmission process. A site of action of drug is nerve terminal, a specialized region of neurons whose function is to synthesize, store, and release neurotransmitter. We are going to give example of drugs interacting with the process of neurotransmitter synthesis, neurotransmitter storage in the vesicle, neurotransmitter release, hydrolysis of neurotransmitter by enzymes, and uptake pump for neurotransmitter, and etc. both in cholinergic and noradrenergic neurons. The autonomic division of efferent peripheral nervous system is subdivided into parasympathetic and sympathetic components. The autonomic pathway between the CNS, central nervous system, and the effector cell comprises of two neurons. The axon of the first neuron emerges from the CNS and terminates a short distance from the cell body of the second neuron. The gap between the two neurons is called synapse. The collection of the cell body in this region gives rise to a swelling of the nerve known as ganglion. Hence, the first neuron is called preganglionic neuron, and the second cell is called postganglionic neuron. The autonomic nervous system provides excitatory and inhibitory innervation of cardiac muscle, isthmus muscle, or exocrine glands. In the parasympathetic section, both peri- and postganglionic neurons are cholinergic. It means their neurotransmitter is acetylcholine. In the sympathetic pathway, the preganglionic neurons are cholinergic, while most of the postganglionic neurons are adrenergic. However, there are exceptions. For instance, postganglionic sympathetic neurons innervating eccrine sweat glands are exceptionally cholinergic. Furthermore, some of the sympathetic neurons innervating renal vascular isthmus muscle are dopaminergic. That means their neurotransmitter is dopamine. The adrenal medulla also receives preganglionic sympathetic neurons. The medullary chromaffin cells synthesize noradrenaline but also possess an additional enzyme for conversion of noradrenaline to adrenaline. Sympathetic activity causes release of adrenaline into the bloodstream. The somatic neuron emerged from spinal cord directly innervate skeletal muscle. These motor neurons are cholinergic, and pharmacology of cholinergic neurons also applies to them. This diagram is presenting the effector organs innervated by sympathetic and parasympathetic pathways. We are going to explain effect of drugs on every individual organ shown in this picture. Therefore, please revise the effect of autonomic nervous system on these organs, because these organs are site of action of so many drugs, and without understanding how sympathetic and parasympathetic activity will alter the response of this organ, learning of autonomic pharmacology would be very tough. Many parasympathetic ganglia are located close to or are embedded within the wall of the effector organ. In general, parasympathetic preganglionic neurons are long, while postganglionic neurons are short. The location of ganglia is important when an organ such as heart or ileum is isolated for drug study. Then you should be aware that drugs effect might be mediated through the parasympathetic ganglia embedded within the organ. Sympathetic ganglia lie on the either side of the vertebra. Sympathetic preganglionic fiber join the course of the mixed spinal nerve, but then branch away to form white communicating ramus, which enter the chain of paravertebral ganglia. There are 22 ganglia in each chain. Each ganglia in a paravertebral chain is connected to the one above and below by nerve trunk. In contrast to the paravertebral ganglia, the perivertebral ganglia, which are located in the abdomen and pelvis, are not bilaterally paired. In some textbooks, A third division for autonomic nervous system is considered called enteric nervous system. The enteric nervous system consists of neurons lying in the intramural plexus of gastrointestinal tract. It receives inputs from both sympathetic and parasympathetic systems, but can act on its own to control gastrointestinal function. In addition to acetylcholine and noradrenaline, many other neurotransmitters are involved, altogether named non-adrenergic, non-cholinergic transmission. Another complex situation is existence of co-transmission in autonomic nervous system. Simply, when sympathetic or parasympathetic neurons are stimulated, more than one neurotransmitter is released from the nerve terminal. For example, it is common that in the adrenergic neuron, noradrenaline is released with ATP or neuropeptide Y. In the parasympathetic neurons, acetylcholine is co-released with nitric oxide or vasoactive intestinal peptide VIP. However, in this section we only concentrating on pharmacology of acetylcholine and noradrenaline rather than other neurotransmitters. Receptors are a typical biological target for drug action, as well as postsynaptic receptors. Presynaptic receptors are site of action for some drugs. This diagram illustrates the physiological role of presynaptic adrenoreceptors. Activation of presynaptic receptors inhibit neurotransmitter release. In another word, it acts as a negative feedback mechanism to prevent excessive neurotransmitter release. This mechanism comes into play when the noradrenergic nerve terminal is exposed to high concentration of noradrenaline. This sort of neuromodulation generally involves second messenger regulation of ion channels. In this case, it blocks calcium channel. The amount of calcium into the cell is reduced, and therefore the noradrenaline release is reduced.